Welcome to my YouTube channel. Today I want to talk to you about dentistry in Australia. The good, the bad, the ugly, and why is it so friggin' expensive? I'm sitting here today, I'm a bit sore, I'm a bit annoyed, a bit pissed off. Got a massive hole in my face. You can't see it from the outside. It's on the inside. There's a crater. And I went to the dentist a couple of years ago to get a root canal. And while I was doing a root canal, they did the initial exploration, took nerves out, cost me $400. They sealed it up, and I was supposed to go back for the final full root canal process. Now, a root canal in Australia currently costs apparently $3,200, including a porcelain cap. So I was in the middle of buying a house at the time, not really flush with funds, and there wasn't really any help from insurance. And I'll get to that in a bit later, but insurance really underpays here in terms of co-payments. Okay, so what do we have here? We've got private health insurance offered little relief for my dental woes. Virginia Trioli, Saturday 8th of November. Now, Virginia, I read through this article, and she's basically talking to us about how she woke up, tooth on the side of her mouth was aching, hot drinks, setting her through the ceiling, yada, 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 yada. Basically needed to go and get some specialist treatment. So she goes to an endodontist, and long story short, she realized she's been duped by her insurance company. So her endodontist appointment, my first appointment with my new tooth man, cost me $360. Bear that in mind. It included a scan. Insurance cover included endodontics as extras, so she opened the app, punched in the item numbers, and uploaded the receipt. The screen resolved to reveal her payout, $25. So $360 and a payout of $25. That's not even the GST. That's not even 10%. It's an absolute rule. So in Australia, dental, even if you've got insurance, you're not getting it paid out. So I found myself in a position where I couldn't have it. 2 years later, I found myself in a position where I'm now flush with cash, got the money, let's go have it done. Anyway, the dentist takes the fillings out, drills a hole in it, gets a camera, shows it to me and says, sorry mate, it's now too infected and there's a crack through it. The tooth's degraded and you're going to have it removed. So I now have a massive hole where there was a molar. Do any of you have these same sort of experiences with dentistry in Australia? I dare say you do, because when I'm reading forums, when I'm reading news articles, article after article, year after year, they're suggesting that the government needs to put more funding into dentistry. I went and had my dental done in Beenleigh Marketplace, which is in Beenleigh, part of Logan City. Logan it's a big area, but it's a city of two sides. It has your upper middle class on one half of it, and socio-economic class of people who are just doing it tough. It's not known for being millionaires row out near Beenleigh anyway. So $3,200 doesn't come cheap. Now, when I had my tooth extraction, he extracted my tooth for $400. It's not a small amount of money by any standard. But if you're comparing it to $3,200, I would wager there are probably more people getting their teeth removed than there are people who are going through with having one tooth root canal and capped for $3,200 when you're struggling. In Australia, we do have public dental. Now, in most states, there is a waiting list. And in fact, Queensland is the worst state. Queensland has a 2-year waiting list for public dental. Plus, you have to meet requirements to be on the public dental. Even in those cases, a 2-year waiting list means we are pulling the teeth out of people's heads for no reason. They're not getting to a dentist in time to solve most oral health issues. Bacteria grows incredibly fast in the mouth. Dental issues, when they come up, they don't just go away. It's a sad state of affairs in a country that has the money to fund this if it had the will to fund this. If you can find $300 billion to build submarines, you can certainly find a couple of $1 billion a year to help subsidise the dental health of your citizens. A big conversation starter would be, where do we get the money? Now, we could increase Medicare costs, but we have to then increase Medicare rates. That means every taxpayer has to pay more, or certain taxpayers have to pay more. I don't want to jump on the tax the rich bandwagon, but to be honest, when we've got the petroleum and gas companies and mining that are drilling resources out of the ground and not returning anything to the Australian public of benefit, could do more. Okay, so just some stats off the dental health website. 3 in 10 people delay or avoid seeing a dentist because of the cost. 1 in 4 children have untreated decay in their baby teeth. And 1 in every 25 have no natural teeth left. All right, so I'm just going to play you a video from ABC, and we'll just watch this for a second.
2. He can't afford to see a private dentist and has been on Queensland's public dental waiting list for 21 months.
The waiting period to see a dentist here, other than for an emergency, is 2 years.
Experts say it's a nationwide problem.
The public dental system is overwhelmed. It's far too small to meet all of the demand for dental care.
Around a third of Australians are eligible for free or low-cost dental care delivered by the states and territories with some federal funding. But unless a patient's issue is urgent, they're likely to be waiting months, if not years.
As a result, we're seeing rising rates of untreated dental decay and toothaches.
While each state reports data differently, for non-urgent dental care, New South Wales aims to get patients off the waiting list within 1.5 years. In Victoria, the average wait is just over 12 months.
If those waiting lists were shorter, the people would be able to keep more of their teeth for longer.
The queues are quicker in South Australia and WA, but in Tasmania in the past 12 months, the median wait was 2.5 years.
There's a lot of links between poor dental health and overall health. One link that we know is very strong is between diabetes and poor dental health.
The issue is also adding pressure to other parts of the health system. Each year, more than 80,000 people are turning up at hospital emergency departments with oral health problems that experts say are largely preventable.
Okay, well that's a wrap for this video. Key takeouts, look after your oral health. It can lead to diabetes. Also, 80,000 people going to ED a year. I think there is some funding that should be funneled towards our dental health because it's actually starting to block up our hospitals. Anyway, thoughts, comments, like, subscribe, all of the above. See you in the next video.